I'm Chris Shandek. Today on CYInterview, we welcome Dr. Vanita Rahman. Doctor, thanks so much for joining us today. How are you?
Thanks so much for having me on the program, Chris.
Oh, you're most welcome. So just to begin, why don't you tell people about your work with the Physicians Committee for Responsible Medicine and a little bit about your background?
Yeah, so I am an internal medicine physician. I'm also board certified in lifestyle medicine. And what we do at the Physicians Committee is we do research. We also do community teaching and advocacy. And I also work in our clinical arm, the Barnard Medical Center, where we provide care to patients with an emphasis on lifestyle, such as nutrition, exercise, stress reduction.
So you're both a medical doctor and a personal trainer, which in our research for the CYInterview, it's a kind of uncommon. So why don't you tell me about how that came about and why you were interested in both things?
Well, Chris, I was struggling with my own health issues. I felt I had a bunch of metabolic issues that I was struggling with, and I was having a hard time getting them under control. And sadly, I discovered that, my medical career trained me very well to manage very complex things like heart attacks or strokes, but not so much about how to eat well, what to put on my plate, how to exercise. We're just told generally to eat well and exercise, but don't really know much more than that. So I took it upon myself to learn more and really understand what exercise means. How do I balance my routine? How do I nourish my body? And what can that do for me?
What do you think is the importance of diet and exercise when it comes to health?
Oh, I think it's paramount. The food that we eat, if you think about it, we're consuming 3, 4, 5, 6, maybe meals a day. That has a huge impact on our health. And research has shown over and over again the importance that nutrition plays in diabetes prevention, reversal, heart disease prevention, reversal, cancer prevention, autoimmune disease prevention. The evidence just keeps mounting up about the benefits of nutrition.
Do you believe a plant-based diet is the best thing that we can do for ourselves, nutritionally speaking?
I do. And it's not a feeling. It's really based on research evidence. So I'm a clinician. I'm also a researcher. So I've reviewed the evidence, and I didn't grow up eating plant-based, but I changed my ways after I learned the evidence was indisputable. And I've seen firsthand, both for me, my family, and in my patients. And then, of course, the research backs all of that up, how profound that can be.
You have written a couple of books, and of course, you've done a lot of research on this topic. What do you think is the one major thing that you could tell a person about why they should consider a plant-based diet?
Because it's going to make you feel great. It's going to improve your health, help you feel like you're in charge. It's a very powerful feeling that something as simple as the food on our plates can help us feel strong and healthy without expensive medications, without complicated surgeries, without complex medical procedures. And it's something that is within reach. So what could be more powerful than that?
What do you think is the role of exercise in our lives when it comes to our overall health?
I think it's very important, Chris. We know that exercise really has a head-to-toe benefit. It reduces the risk of dementia, cognitive decline, reduces the risk of stroke, decreases the risk of cardiovascular disease, high cholesterol levels, high blood pressure. The list just goes on, diabetes. It improves aches and pains. It improves our mood. It improves our gut health. So it should really be essential. And many of us think of exercise history as an essential vital sign, in addition to blood pressure, height, and weight, is how much is someone exercising?
The United States of America is currently dealing with an epidemic of overweight and obese people. Do you think that the medical community as a whole is doing enough to help these people have better lives? Do you think more that can be done? Do you think we're in a dangerous situation right now?
I do think we're in a dangerous situation. Over 40% of American adults are obese. over 70% are obese or overweight. So about 30% of the population is at a healthy weight. Those are frightening statistics. And we know that obesity and overweight are not cosmetic issues. They increase the risk of chronic disease, such as diabetes, heart disease, cancer, and so on. Is the medical community doing enough? I think the medical community is well-intentioned. I think most healthcare providers really do care and mean well. I think what we have, Chris, is an information gap between what we need the healthcare providers to know versus what they know. Their knowledge base about nutrition and exercise is maybe here, it needs to be here. And if providers don't know what healthy nutrition is, if they don't know what healthy exercise is, then how can they help their patients lose the weight? How can they help their patients take control of their health? So we really need to close that information gap.
How do we close that information gap?
By doing what you're doing right now, getting information out there. So thank you for contributing. And there are other things we need to do. We need to publish research. And groups such as ours and others all over the world and across the US are publishing valuable research showing the importance of nutrition. But we need to get clinicians to read that information. We need to disseminate that information. And that's where health conferences are so important, getting that messaging out there. And there's a lot more we can do, such as requiring a certain amount of nutrition education for physicians, not only in medical school and residency, but even afterwards, to continue to maintain their licensure. So there's a lot more we can do. And I think we will eventually get there, but I hope we get there sooner rather than later.
So one patient at a time, what do you tell people when you see someone dealing with a challenge and you think they can live a healthier life?
Well, in medicine, it's really about helping patients make informed decisions. So I present to them their option. Let's say someone has been diagnosed recently with diabetes. I discuss the impact a plant-based lifestyle could have. I discuss the impact regular physical activity could have. And then I discuss the impact medications can have. And then I ask them, where would you like to start? What would you like to do? And almost every patient would rather change diet and exercise than take medication, because they've tried medications before. They know they have side effects, they're expensive, and they understand they're not reversing the course. So most people are very motivated to try diet and lifestyle. Our role as clinician is to give them the tools to succeed.
And what are you seeing in some of your patients that you have been dealing with for quite a while, and those positive things? What would you say if you were going to look at it, looking back on all the experiences that you've had?
There are so many success stories. The one that really stands out to me was a woman that I saw who had been newly diagnosed with diabetes. And her A1C, which is what we measure to keep track of blood sugars over a 90-day period, was nearly 12. A normal value is about 5.5 or less. Her provider had recommended insulin for her. She didn't want to inject herself. She didn't want to take insulin, and nobody really does. And so she learned about plant-based eating. She came to see me, and she was very motivated, very committed. She also had a significant amount of weight she wanted to lose. So we worked together. She changed her diet. She started eating a plant-based diet. And within 3 to 6 months, she had lost significant weight and put her diabetes in remission.
Just so our viewers know, what would you define as significant weight?
So about 30 to 45 pounds of weight loss, which was very significant for her. And her A1C, which had been over 11, was now 6.5. It was now closer to the pre-diabetes range. And a few months later, she had decreased it even more. So she was in remission. She no longer had diabetes. And it was just such a profound impact for her. But here's the thing, Chris. The best part was she did it in a way that was healthy, that was sustainable. This wasn't a fad or a gimmick. this was a way of eating that she could continue indefinitely because she liked the food. She liked the way it made her feel. And it didn't feel like something just short term. It felt like a lifestyle change for her.
So complete this thought for me. For anybody who does not eat fruits and vegetables in their daily life, if they added some fruits and vegetables to their daily lives, what do you think might happen?
Well, I think they can expect to see the benefits of consuming more fiber. First of all, their fruits and vegetables are loaded with fiber. They may expect their gut health to improve, more regular bowel movements, relieving of constipation. And depending on, what they're substituting those fruits and vegetables for, they may expect to see other improvements in their health, such as blood sugar levels going down or cholesterol levels going down or even their blood pressure improving.
So in closing, why don't you tell us a little bit more about what you do at the Physicians Committee for Responsible Medicine and what your daily life looks like?
So we, our days are very busy. We do a lot of exciting work. And for me personally, I do a combination of patient care where I see patients in the clinic and I see them via telehealth. I'm licensed across 11 states in the US. So we've been able to reach a wide number of patients. And then I also engage in clinical research. We have an ongoing study right now about diabetes reversal. And then I also do some clinical or special education programs. We're currently running an online weight loss program that's available for anyone who has access to Zoom to help people lose weight. And then we're always doing community advocacy and outreach. I also work with medical students. I'm a clinical instructor of medicine at the George Washington University School of Medicine, where I precept students. So our goal is to show, future doctors the value of nutrition and lifestyle as they're trained.
Well, that's truly phenomenal, Dr. Rahman. Anything you want to leave our viewers with today?
I really want to impress upon people that I know many of you may be struggling with health issues, but I encourage you to become informed, to empower yourself by learning more about plant-based nutrition, and know that that's a powerful tool that many healthcare providers may not recommend because they simply don't know. But you can learn and really reap the benefits.
So the first step for a person should be?
Go to pcrm.org. Look at our webpage. We have a ton of information on nutrition. We also have over 100 colorful, beautiful recipes. You can comb through and see what appeals to you.
Dr. Rahman, thank you so very much for joining us on CYInterview. Anything you'd like to add?
Thank you, Chris, for all the work you're doing, and to the listeners for tuning in. And for those of you who support our mission, we couldn't do it without you. Thank you.
We really appreciate your time today.
Thank you, Chris.
Thank you for watching today's CYInterview segment from Las Vegas. Please hit the like button and please hit the subscribe button to be updated on all future CYInterview content from Las Vegas and beyond.